practitioner today. I'm doing my hand hygiene. We're going to do an abdominal assessment, so I'm going to take a look at your belly, and then we will also do a musculoskeletal assessment, so we'll do some range of motion activities and things like that, okay?
Okay.
Do you have any questions?
No.
No? Well, if you can go ahead and lie down for me. We're going to start out with your abdominal assessment. If it's okay with you, I'm going to lift your shirt up a little bit.
Okay.
Okay. So first I'm inspecting the abdomen. I'm looking for any scars, any distension. I don't see anything like that. So next, I'm going to move on to auscultation. And I'm going to auscultate the 4 abdominal quadrants and listen for a bruit over the aorta. Hope this isn't cold for you. No bruit. Alright, and you have active vowel sounds times 4. Next I'm going to move on to percussion. So I'm going to start in the right lower quadrant. Appropriate dullness at the costal margin by the liver. And no other areas of dullness. Next I'm moving on to palpation. I'll start with light palpation, and then move to deep palpation. Any pain or tenderness?
No.
I'm feeling for masses. Go ahead and take your right arm and put it up over by your head. Big inhale for me. And I can palpate the liver below the costal margin. You can go ahead and exhale and relax. You can bring your arm down. Continuing with light to deep palpation throughout the rest of the abdomen, and no masses are palpable. Okay, we've completed our abdominal assessment. I'm going to go ahead and bring your shirt down. And if you can, go ahead, actually before we move on, we'll go ahead and do your a sensory assessment. So close your eyes. This is a sharp sensation. This is a dull sensation, okay? So I'm going to go to both your arms and both your legs, and I want you to tell me if you feel sharp or dull, okay?
Okay. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull.
All right, awesome. Now if you can, go ahead and stand up for me. And go ahead and take a couple steps forward. I'm assessing the gait. Okay, now walk back towards me. And no gait abnormalities are noted. I'm going to go ahead and inspect general muscle bulk. And also assessing its clavicles and shoulders. Assessing the spine. I'm going to go ahead and lift your shirt up a little bit. Okay, no spine abnormalities are noted. We're going to go ahead and do some range of motion exercises. So go ahead and copy me. I'm going to have you touch your chin to your chest like this. Okay, and then extend your neck back. Good. Now I want you to bring your left ear to your left shoulder. Good. And then your right ear to your right shoulder. Good. Now go ahead and turn and look towards me. Turn and look towards the wall. Okay, any issues, pain or tenderness anywhere?
No.
Okay, go ahead and turn against resistance. Good. Turn against resistance. Good. Cranial nerve 11 is intact. We're going to go ahead and assess your spine range of motion. So go ahead and just touch your toes. Good. Go ahead and stand. Now we're going to do lateral left flexion. So go ahead and bend to your left. Good. Now bend to your right. And it's symmetrical. There are no issues with the range of motion. Okay, next we're going to move on to your shoulders. So go ahead and bring your arms up overhead like this. For abduction, now bring it back down to your side. For adduction, any pain or tenderness.
No.
Range of motion is symmetrical. Okay, go ahead and bring your hands up by your ears. Good. And then bring your hands to your sides. Scratch your back with your right arm. Reach as far as you can. Good. Same thing with your left arm. Scratch your back, reach as far as you can. Good. So we assess for external rotation, internal rotation. No abnormalities. So I want you to go ahead and flex your arms in like you're flexing your biceps. Good. And go ahead and extend out. And now we're going to do the same thing against resistance. So flex in again. Strength 4 or 5. Good. Now go ahead and flip your hands so that you're pushing out forward, assessing the range of the biceps and triceps, we are going to move on to your wrist. So go ahead and stick your hands straight out. I want you to extend your wrist up, and then flex your wrist down. Put your fingers straight forward, and then supinate, so bring your thumbs up, and then pronate. No issues with range of motion there. Any pain or any issues with any of those motions?
No.
No? Alright. Well, we've assessed the upper body. I'm going to go ahead and have you lie down. We're going to assess your hips and your knees as well. Alright, so we're going to start with active range of motion. So just lift this right leg up, straight up in the air. Good. Bring it back down. Bring your right knee to your chest. Good. We're going to do the same thing with passive range of motion. I'm bringing your leg straight up. Okay. And then bringing your right knee to chest. Any issues?
Nope.
Okay. I'm going to assess your meniscus. So we're extending out with that rotation. Any issues?
Nope.
Do not feel any crepitus. We're going to do abduction of the hip. So I'm bringing you out. And then bringing you back to the midline for adduction. Any issues there?
Nope.
No? Alright, we're going to go ahead and extend your leg out, and we're going to do the same thing on this side. So bring your left leg straight up. Good. Go ahead and come back down. Left knee to chest. Good. Alright, I'm going to jump in here, do the same thing. Leg straight up. Good. Knee to chest. Good. We're going to assess your meniscus again. So extending with that rotation. Any pain?
Nope.
No, any crepitus. We're going to do the abduction. And then adduction, no issues with range of motion there. So, gonna go ahead and palpate your knee while you're still lying down. I'm checking for symmetry, no signs of swelling, any tenderness with palpation. Okay, and no crepitus with palpation either. Alright, so we're gonna go ahead and come over to the chair. Sorry to kind of have you hop around. Okay, I'm gonna grab my reflex hammer. We're going to go ahead and assess your reflexes. So I'm going to start with your patellar reflex. Try and relax as much as you can. There you go. Take the other side. Good. +2 symmetrical. Then we're going to do your Achilles. Good. Good. +2 symmetrical. We're going to do one more range of motion exercise. So go ahead for your ankles. Go ahead and extend your ankles. Perfect. Now point your toes down. Then we're going to do the same thing against resistance. So come up against my hands. Good. And then push down. Good. Strength score of 5. Alright, we're going to do some reflexes in your upper body. Start with your left arm with your brachioradialis. About 3 inches up above the wrist. Good. Now we're going to assess your biceps tendon. Try and relax as much as you can. I'm assessing the muscle. I see the muscle move. You're going to do your triceps reflex. Good. Do the same thing on the other side. Coming over here. Okay. We're at 3 inches above the wrist. Try and relax as much as you can. Good. Do the biceps. A little tough for me. There we go. And then we'll do the triceps. There we go. And all of your reflexes are +2 and symmetrical. I think we've covered all of our bases here. Do you have any questions?
No.
No?